Hi, everyone.
Hi, Gabby.
Hi, happy Tuesday. Happy Tuesday. Sorry. I hope you guys are having a great week so far and excited for the Thanksgiving weekend that's upon us. But yeah, today we're gonna be talking about mindfulness during your pregnancy and focusing on kidney um, enlargement and what's going on with that. But today I'm joined with Dr. Reya Mokiao and Dr. Tara Lawal. Thank
Hi
you.
there.
Hello.
Hi.
Okay. Well, thank you, Gabby. If it's okay, we'll start off with some introductions. Um, I can go first. I'm Tara Lawal. I'm with the PI Health Board. I'm one of the perinatal nurse specialists here. We've been having a lot of fun over the last 6 to 8 weeks working with our baby and youth segment where we're teaching perinatal classes, childbirth ed classes to families that are Pacific Islander. And a lot of questions came up about their health. And we saw a couple cases where we had babies that had enlarged kidneys. And we started talking about mindfulness and how do we stay present when we have like these huge issues? What does it mean my baby has huge kidneys? And I go, you know what? I have a friend who knows all about this. And I said, we need to bring in Dr. Reya Mokiao to come talk to us. Um, she is a native Hawaiian. I'm going to let you introduce. A nephrologist who works at Seattle Children's. She's here in Seattle. We're so grateful to have your expertise in our community. And we connected earlier this year over one of the projects that you're doing. And so, as we were in our class, our perinatal class, I just thought of you and I was like, we got to get you on. We have to talk about this because there's so many things that I think you and I could just unpack today. And so, first off, welcome. Thank you for being here. Can you introduce, like,
Mhm.
how did you get here? Number one, I am just floored that we have a Pacific Islander woman who's a nephrologist, who's so young and a mom, like here in Seattle. I am just so proud of you. I'm so proud that you got to this space as a specialist. Tell us a little bit, like, let's start off with your journey. How did you get here to where you are?
Thank you so much, Dr. Tara. So you saying all of that just gave me like chicken skin, and I'm so that's so sweet for you to say all of those things. But I am actually very honored to be here, and I'm so glad that you thought of me and invited me to speak with you and to speak with everybody else. But my name is Reya Mokiao. I was born and raised in Hawaii. I am Native Hawaiian. I'm also Samoan and Filipino. For those of you that are familiar with Hawaii, I went to Kamehameha, graduated in 2006, and then I went to college in Oregon at Pacific University. Lots of folks from Hawaii end up in Oregon at Pacific University. I think at the time it was like 30% of the student body was from
Wow.
Hawaii. So some people might know, have heard about it. Really small liberal arts college. So went to college from 2006 to 2010. And then from there, I took a gap year after college and applied to medical school. And I ended up attending medical school the following year at Cornell in New York City. It's located on the Upper East Side in like busy New York City. So I went to medical school in New York and took 5 years to graduate because I took a year in between to do like research, which is super common. And so I ended up graduating from Cornell Medical School in 2016. And then from there, During medical school, I decided to go into pediatrics. I just loved working with kids and families, and I just felt like really comfortable in that role and with other pediatricians. So then I went to pediatric residency also in New York at Cohen Children's Medical Center, which is part of the Long Island Jewish huge health system there, for 3 years. Loved my experience, loved doing residency there. And it was really during my residency program that the pediatric nephrologist there heard that, I might be interested in kidneys. And so they just like, supported me, mentored me. And the amazing thing about that residency program and about the pediatric nephrologists there is that they're all women. They all have families. They, some of them are like come from underrepresented backgrounds. And so I just really connected to them. And they really fostered my love and knowledge of everything kidney. And so after my residency experience there in New York, so overall I was in New York for like 8 years, I realized I needed to get closer to home. So home being Hawaii. It was just too far, and too many times during that 8-year period on the East Coast, it was just, I couldn't be a part of like smaller family gatherings or anything like that, just with the travel. So it was a priority to move back to either Hawaii or the West Coast. And then what actually brought me to Seattle was my pediatric nephrology fellowship training, which I did at the University of Washington in Seattle Children's Hospital. I started my fellowship in 2019, and it was 3 years. So I just graduated from my pediatric nephrology program last year in 2022. Wow. At the same time that I was doing that nephrology fellowship, I also completed my master's in science in epidemiology at the School of Public Health here at University of Washington. And then all at the same time, I also completed a child health equity research fellowship because during my training, I realized that I wanted to be a researcher and focused on understanding the health of our Native Hawaiian Pacific Islander communities, especially related to kidney disease. And my ultimate goal, career goal, research-wise, is to work with local Native Hawaiian Pacific Islander communities and, co-design interventions, health interventions with the community that are focused on our youth, our Native Hawaiian Pacific Islander youth, to improve their health, including, addressing things like that are becoming more prevalent in our communities, like obesity and diabetes and things like that, which ultimately lead to kidney disease. So my entire research career is kind of focused around working with NHPI youth and families to address those risk factors that can ultimately lead to kidney disease down the line, to prevent kidney disease. So I'm mostly research focused right now, but of course I do see patients pretty regularly. And being a pediatric nephrologist, I'm super specialized. And so my expertise is in pediatric kidney disease, but I was trained in general pediatrics. So I do have that background. But, when it comes, like I was telling Dr. Tara, when it comes to prenatal care and maternal child health, that's where I refer to Dr. Tara for her expertise, because that's a little out of my scope.
Okay. Woo! Looking back, can you believe you did this?
No. No, being here right now and being a doctor wasn't even something that I thought I could achieve. It wasn't even in my goals when I was growing up. And it wasn't until actually the last year of college, or second to last year of college, that I realized hey, what am I going to do for the rest of my life? I like school, I like chemistry, I like biology. Like, what can I do with that? And so then I don't have any, like, no one in my family is a doctor. Not very many people like went and graduated from college. And so these were all like uncharted waters, and honestly not something that I ever thought I could do or wanted to do. But I had support from my friends, who are also going to medicine. And yeah, so I just started to talk to some doctors in Hawaii, actually shadow them, understand what their experience was like. And that's when I decided, okay, I'm going to do this. And then now I'm here. Like, once I made that decision, I feel like I was just like put on this like treadmill or conveyor belt, and I just like going and going and going. And I cannot believe that I am here today talking with you all.
Wow. I am so proud of you. And I say this because I know the journey that you're on, and how long it is, how stressful it is to keep going, and then getting into these, incredibly intensive programs that you've done, medical school, and then doing your residencies. And at the same time, you also have a personal life, and you have a family, and you have 2 children. That just, I know how that goes, and I know the sacrifice that your family had to make so that you could keep going. So
Oh, for sure. I would not be here today. Thank you for mentioning that. I would not be here today without my husband. He has been my rock, and he takes such good care of both of our kids, to where I know that they're taken care of. I know they're safe, that I can put my head down and do what I need to do in order to, reach my career goals. So I definitely would not be here today without the support that I have, especially from my husband.
absolutely. Wow.
Yeah.
That's so glad. I hope he's watching and he's proud of all the work that you've been doing. Because, you're right. It's very hard to find women, especially PI women, to keep going. Like, when you finally realize what your path is, especially in medicine, in healthcare, in a service where you're giving so much of yourself to people, it's exhausting and it's hard, and it takes a village for one of us to get to this doctorate level.
Right. And I, like Dr. Tara said, I just met her earlier this year, but I am just in awe with everything that you have done and accomplished, and your recent, graduation from your doctorate program. And so literally everything that I said, I'm sure you have, you can say the exact same things about your journey. And
I know what you're going
amazing too.
Okay, I just realized I'm on call today, and I just got a page. So I'm going to turn the time to you and ask you to explain why we're here. So we're really going to dive right into what are kidneys? How does it affect us as we grow a baby, like when we're pregnant? And then I'll kind of like guide some of the questions that we've been unraveling in our classes. And so, Gabby, do you want to start us off with that picture? And then, Reya, do you mind if you take over and like give us a little tour of the kidneys?
Sure. I'll just keep talking, and then please, come back and interrupt me and ask me questions when you're able. Yeah, Gabby, do you mind just putting up that picture with the kidneys and then the ureter and the bladder, just so we can start the conversation about the kidneys with a visual, so everybody has an idea of what we're talking about? Okay, well, maybe I will, oh, there we go. we went over this even before, and somehow technical difficulties always happen. Okay, thank you so much, Gabby. Okay, so this is called our genital urinary system, and then it's comprised of our kidneys, which are these two things up here. It's labeled, and your kidneys are about the size of your fists when you when you make a fist like this, and they're located at the in the back, in your back, at the bottom of your rib cage on both sides. So you have two kidneys, and then the kidneys are connected to this tube, and this tube is called the ureter, which takes urine that's made in the kidneys and transports it to this structure here, which is called your bladder. So this is where the urine that's made from the kidneys is stored. And then from here, from your bladder, your urine, your pee goes out of your body through your urethra. So that's the normal flow of urine. So urine is made in the kidneys, flows down the ureters into the bladder, and when you have to pee, your bladder will compress and it'll come out your body through the urethra. Okay, and so this entire thing is called your genital urinary system. And my expertise is really in the kidneys themselves. And so, you know, some of you might be wondering, like, what do our kidneys do and why are they so important? So our kidneys do many things, but the two main important functions of our kidneys are to clear or filter our blood. You know, so our body, as it's functioning, makes waste. And then that waste goes to the kidney and gets filtered out. And the waste gets filtered out through the urine. So not only does our kidneys filter and clean our blood, but it also makes urine. And that's how all of our waste products are removed, is through our urine. So those are the two main functions of our kidneys, but our kidneys are so much more important than that. You know, they, even though they filter out the waste, they also help to maintain a balance in our body when it comes to some of the electrolytes and minerals and things like that in our blood. So sodium is regulated by our kidneys, potassium, phosphorus, and other minerals. Everything is maintained in a balance because of our kidneys. Our kidneys are also responsible for a couple of hormone functions. So our kidneys help to ensure we have strong bones. So it affects our bone health. Our kidneys also affect our red blood cells, or hemoglobin, or blood level. And it also affects our blood pressures. So our kidneys do so many things. And so when our kidneys are not working well, or if, they completely are not working at all, and we need to be put on dialysis or transplant, or get a kidney transplant, luckily we have those options, because our kidneys are so important to our everyday lives that we really need them to live and to survive. And if they're not working, then that's when, somebody will need to start dialysis, or will need a kidney transplant, so that they have something that can function as a kidney with dialysis, or have a new kidney placed so that it can do all of those functions that I mentioned. So your kidneys are quite important, and not something that a lot of people actually think about regularly, but it's something that I think about all day, every day. And so I know that Dr. Tara, in her role as with her prenatal program, and working with various patients, that they've had some other babies have these enlarged kidneys, like she mentioned. So I just wanted to talk a little bit more about that. But if you guys have any questions or comments, I'm not sure if you could put that in the chat. Gabby, is that a function that is possible? If so, please go ahead and put your questions there and I can answer them. Again, my expertise is really pediatric kidney disease. But yeah, so we can start talking more about this hydronephrosis, which is what really sparked this whole talk story session with Dr. Tara and her patients. So hydronephrosis, what that refers to is extra fluid or extra urine being stored in the kidney. So like I mentioned, the kidneys make the urine, but the urine shouldn't be stored there. The urine should really only be stored in the bladder, which can expand to accommodate your urine. So if you have urine that's being collected in the kidneys, then that can be abnormal. And that's what we call hydronephrosis. It's just like extra water, hydro, in the kidney. And Gabby, do you mind showing the other photos of the ultrasounds, please, if you can? Perfect. So this is what your kidneys will look like on an ultrasound. So the ultrasound is just that probe that we use to look at babies in the belly, and it's used for multiple other things, but it's a good way to get an image of what's going on in your body and look at some certain organs, so including the kidney. So this here is an ultrasound image of a kidney, and this is a normal looking kidney. So you see it's like, there's not a lot of black space, okay? And then if you go to the next image, Gabby, here's where we can start to see the differences. So just remember that normal kidney, and then now look at these ultrasound images, which show more black space in the middle of that kidney. And that black space is fluid. So that's extra urine being stored, being trapped, being held there in the kidneys, as opposed to going down into the bladder. And the amount of hydronephrosis, or the amount of urine that's there, varies. So here on the left, we have mild. So it's kind of there, but usually it's not going to cause any problem. And then we have this moderate, so it's more than mild. And that may start to cause problem and kidney damage. And then we have here on the right, severe hydronephrosis. So that's where you have a lot of urine being stored there. And that can cause, just having all that fluid there can cause compression on your kidney tissue and cause damage. And so hydronephrosis is something that, we see quite often in my subspecialty in pediatric nephrology. And also that you can start to see prenatally. So hydronephrosis can be diagnosed during the second trimester of pregnancy. And if we start to see, this hydronephrosis, this collection of fluid within the kidney, then the patients need to be monitored pretty regularly, every couple of weeks, to just see what's going on with that hydronephrosis. Luckily, majority, like up to 80% of hydronephrosis that is seen on ultrasound when you're pregnant will go away on its own without any intervention. It'll just go away after some time. So like most will go away even before the pregnancy, but if not, that's when I come in and I start to see the baby after they're born and monitor the hydronephrosis with ultrasounds going forward. And even then, if the hydronephrosis is present at birth, for most kids, it goes away. It'll go away by the time they go to school. But the reason why we monitor them with ultrasounds every couple of weeks during pregnancy and then every couple of months after they're born is because even though we expect, most kids, it'll just resolve, for some it doesn't. For some kids, it doesn't go away and it can actually get worse. And so that's why they need that close monitoring. But again, for the most part, it goes away. And another question that I get commonly is like, was there something I could have done to prevent this? Was there something that I did to do this? And the answer is no. Hydronephrosis is something that just happens. And it's not necessarily something, as far as we know, it's not something that you did or you ate or that you didn't do that contributed to that hydronephrosis. And for a lot of families that I've met, that's once they hear that, it really helps them just from a mental side of things, to just realize that they were not at fault, because you are not at fault if this happens. It's just something that happens during development. And that needs to get monitored closely by your provider prenatally, or by your doctor after the baby is born. But that's one of the reasons why, seeking prenatal care early is also important, so that we can identify whether, the baby has this or not, and make sure that we continue to monitor it going forward throughout the pregnancy. And then it'll give us like what's going on during pregnancy with the kidneys for the baby. What's going on there will give us an idea of how closely do they need to be monitored once they're born. So we get a lot of information when we have more, when we start to see the patient and the kids when they're already in the belly, or when they're already in the belly. Yeah. So yeah, that's hydronephrosis in a nutshell. And there are lots of other, like, the pathway for other folks, for people that have hydronephrosis, can be quite variable, but that's why it's important for you to, if this is happening with your child, for you to seek care so that they can be monitored closely.
Thanks, Reya. I'm always amazed at how the kidneys they're so small, but and literally, like, are they the size of your hand? Like,
yeah, about
tiny little kidneys, but they have to regulate your whole body. And by the time we realize it's something going on with the kidneys, it's too late. But we could have fixed this. There's things that are preventable, kind of like a UTI. We feel the burning and we're like, oh, it's going to go away. Like, you feel burning in your sensation when you're peeing, and you're like, oh, it's nothing. And then we wait and wait. And then all of a sudden, like, your back is killing. And then it's like you have a high fever and you've been sick for a few days. And now you have pyelonephritis. And you're like, why didn't I go in earlier? And same thing with gestational diabetes, or with, like you're saying, with hydronephrosis. Like, I don't know, there's just things like the kidneys are these tiny little things, but they are they're a crystal ball to our future health. And
I love that. That's such a nice way to put it.
We say this in pregnancy. There's things that we learn that will teach us about our future. I'm going to go back to the hydronephritis. Like, the reason we started seeing that, I don't see it very often. You're like, oh yeah, that's one of the most common things that you see, but we don't see that often. And it's like, okay, why would these babies, why are they having enlarged kidneys? And the next question when we tell this to the mom is, what did I do? Like, what did I do to cause that? What would you say to people?
Right. Yeah, that's one of the first things that I will, like, tell families, is that it was really nothing that they did. To kind of, like, absolve them of any potential guilt that they're having, and especially if it's, like, your first child, and, you get told you have to see, like, a specialist. There's a lot of anxiety on that first meeting, when I'm seeing families. And so oftentimes, like, I'll start the appointment with, like, so can you tell me a little bit about why you're here? And then they'll say the hydronephrosis. And I'm like, okay, just so to let you know, like, to get to the punchline, like, already. It's like, based off of what I've reviewed, I expect for this to go away without any problems. And there was nothing that you did to cause this, and nothing you could have done to prevent the hydronephrosis itself. As far as we know, nobody's at fault. It's just something that happens during development, and we don't really, it depends on why the hydronephrosis is there. So sometimes, the reason why a lot of the hydronephrosis just kind of goes away on its own is like the way that the ureter like attaches to the kidney, and with babies being so small, sometimes things can get a little kinked, with the flow there. And then as they grow, there's more space. And so then things can kind of like unkink and straighten itself out.
Yeah.
And hydronephrosis will go away, but for the most part, when it comes to hydronephrosis specifically, that's something that I try to do like from the get-go is like, there's nothing you could have done. There's nothing that you did. And I anticipate that this will just go away without having any like damage to baby's kidneys going forward. But there is a chance that's not the case. And we have to monitor baby closely to make sure that things don't get worse, but that's not as common as things getting better. But to kind of like get back to your point about like gestational diabetes and UTIs and things like that. So yes, gestational diabetes itself like doesn't, as far as we know, like doesn't necessarily cause the hydronephrosis, but we do know that babies that are born to moms with gestational diabetes, they are at risk later on in life of developing diabetes themselves, like overweight, obesity, and diabetes. And then that ultimately, down the road can lead to kidney disease. And so, controlling gestational diabetes, or one, being diagnosed with gestational diabetes, and then like controlling the blood sugar and everything like that is important for a baby like in the
womb.
Like in the womb, and then also has implications for baby down the line as they're growing up.
Can you explain, like on a very general level, how does diabetes affect the kidneys, or how does kidneys affect diabetes?
Yeah, sure. So in Native Hawaiians, Pacific Islanders, well, okay, let me just take a step back. Like chronic kidney disease is something, or kidney disease in general is something that is not very well appreciated because it's so silent. Like you don't start to notice any like symptoms or effects of kidney disease until things are far down the line, like because your kidneys do such a great job at maintaining that balance in your body and doing its job that it will work so hard until finally, like even when things are not going well, until it finally doesn't. So kidney disease is more common than we appreciate. I think the CDC, or the Centers for Disease and Control, estimate that about 14% of the general US population has kidney disease, and like 90% of those people don't even know they have it.
Wow.
And even when you're thinking about even people that have like really bad kidney disease, like 30% of them don't even know that they have kidney disease. So it's something that's just like overall underappreciated. And then in our communities, in Native Hawaiian Pacific Islander communities, unfortunately, like so many other, medical conditions, happen more often in our communities than they do in other, communities and races.
Yeah.
So, and that's kind of where my, work and research is based on, is like, we know that our communities are highly affected by kidney disease. What can we do to prevent that? And so diabetes is a major cause of kidney disease in general, but then especially for our Native Hawaiian and Pacific Islander folks. It's about like, I think the estimates are like 60 to 70% of folks with kidney disease, it's due to diabetes.
Yeah.
And then the rest is due to like hypertension or high blood pressure, So these two risk factors, diabetes and high blood pressure, that's something that you think about with like some other medical conditions or heart disease. But those are the major things that are contributing to kidney disease as well. And so really, if we're trying to prevent kidney disease, it really starts with prevention of diabetes and high blood pressure, which also gets back to, our weight and making sure we do healthy activities, healthy behaviors to reduce, our rates of obesity and overweight, so that we don't start that trajectory towards high blood pressure, diabetes, and kidney disease.
Yeah.
And diabetes, it affects our whole body.
Totally.
I'm not a diabetes specialist, but it has so many different effects. Having this high blood sugar, it affects cells in all throughout our body, including our kidneys. And so
like it even is symptomatic head to toe. You get headaches, you lose your hair, you get like vision problems, your eyes, your retinas, your teeth. It affects, the way you breathe, your nose, and then down to your hearing, into your heart. Then there's your kidneys. You have stomach problems, like, so much of the way you digest food, the way you're able to metabolize food. It's in your gut. Yeah, like the gut health, the way you pee. It's like literally going down your legs. Many people have problems when you have diabetes with neuropathy, all the way down to your toes. Literally, it is a head to toe. It's so symptomatic. And now you're something that we were talking about. You said kids are getting diagnosed now early. Like, tell us a little bit about diabetes in children in the pediatric world that you're seeing.
Yeah. So so diabetes in childhood is still low. But like low meaning, like, I think the estimates are like about like less than 1% of children in the US have type 2 diabetes. Okay. But we've noticed that over time, even though it's a small amount, even over time, the amount of kids that are being diagnosed is getting higher and higher. And so if this trend continues of more kids being diagnosed with diabetes, that number is going to be more than 1%, right? And then similarly, indigenous communities, including Native Hawaiians and Pacific Islander children, have more diabetes than other, like non-Hispanic white communities, for example.
Yeah.
And so, we are starting to see more diabetes in our children. And that's not surprising, just given that, we've noticed in terms of overweight and obesity, that's happening more and more commonly in our children. And we know that obesity and overweight, being overweight, does increase your risk of developing diabetes. So, we're seeing this increase in overweight and obesity in general, but then also especially within our children. And then we're also at the same time, we're seeing this increase in diabetes. And then 20 years down the line, we'll probably start to see these things happen earlier and earlier, right? And then eventually these kids, our kids that have these medical problems that usually were only seen in adults, right? But now we're starting to see them in our kids, that they, will start to develop kidney disease earlier. And that's something that has been noted in other communities, and including indigenous communities around the world, is that our kids that have overweight, obesity, and or diabetes as children, they go on to develop kidney disease much earlier than other communities out there. And so
tell me, what is kidney disease? Like, we know hypertension can lead to kidney disease. Diabetes leads to kidney disease, but what is kidney disease?
Yeah, so kidney disease is really just your kidneys not working well. So like our kidneys, right, they filter our blood, they clear our blood of waste and things like that. And so we think about our kidneys in terms of how well are they functioning. And so there are, certain blood tests that we can do, and even urine tests that we can do to kind of figure out like how well our kidneys are functioning. and if there's any kidney injury present. And so kidney disease is really just your kidneys are not functioning normally. Their function is lower. And so some people might have heard of like your glomerular filtration rate, or GFR.
Yeah.
That is basically your kidney function. So like we would expect like a GFR or kidney function of like 90 or higher, you know? And so if that number is lower than that, then that's like reduced kidney function. And technically that is kidney disease. And then over time, if your kidneys continue to get injured with pyelonephritis, or like with really bad UTIs, or certain medications, or diabetes, or high blood pressure, that in and of itself will continue to damage the kidney tissue that you have. And then your function will go from normal to lower and lower and lower because of all of these injuries and insults to the kidney. The kidneys are just getting punched, right? And then your function is just going to continue to get lower and lower. And then that's when, you start to see symptoms of kidney disease. Like people might be like really tired, really itchy. Not just, they might not be functioning like normally. Something just doesn't feel right. And so that's when we start to see symptoms of kidney disease, when your kidney function just becomes so low. But that's really what we're talking about with kidney disease, is that your kidneys are not functioning normally. And there's a spectrum, there's like there's 5 stages for kidney disease. So you have stage 1, which is like, you might have normal kidney function, like your GFR might actually be in the normal range, but you have structural abnormalities, like on imaging, things just don't look quite right. And then from stage 1, you progress to stage 5, and stage 5 is where you need dialysis because your kidneys are just not working well enough to keep your body in that balance, or you need a kidney transplant. And so, in pediatrics, we really try, and in nephrology in general, once we identify folks that are like earlier on in kidney disease, or even before, we start to see kids once they already have some sort of kidney dysfunction, abnormal kidney function. We try our best to prevent progression to that stage 5, and there are things that we can do to prevent our kidneys from going to stage 5. Especially for our adults listening in, controlling your blood sugar. So we talked about diabetes and high blood pressure, injuring our kidneys and causing that kidney disease. If we control our blood sugars and take our diabetes medications and see our doctors regularly to make sure we are in a good range, that can really help prevent progression to dialysis. And then high blood pressure also, making sure that we follow the low salt diet as best as we can, increase the fruits and vegetables, exercise, lose weight, and take our medicines and have regular follow-ups with our doctor. Controlling those things can really help delay that kidney disease to dialysis. It's been shown like time and time again that really helps. And so that's things that we talk about with our kids too, is about controlling blood pressure, and like I said, I do see like teenagers with type 2 diabetes and already have kidney problems already. And so then I talk with them about controlling their blood sugars and all of that too. But it's hard, right? To like listen, to hear like, you got to do this, you got to do that. But it's like, how am I supposed to do that when I got to work? I have to get, I can't miss any more time off. I don't have, like, when am I supposed to go? I don't have time to go to the grocery store, or the grocery store is far, or the food is too expensive. Like, there's so many life things that affect whether we're able to do what we need to do for our health, so it's a hard place to be.
School just ended. This is KJ. He's 7. Welcome home.
My daughter's 7 too.
Okay. Do you have a 7-year-old too? Okay. Um, I was just thinking, a lot of us have cousins, aunties, uncles, grandparents who are on dialysis, our parents. Um, and so you're like, oh, that's like the ultimate. Or we're all like, are we going to have to share our kidney with somebody? Like we have these fears. What does dialysis actually do for people? How does that help? Like, can we save our kidneys?
That's a really good question. And that's something that I get all the time, actually. So if your kidneys, if your body is to that point where you need dialysis, then you need dialysis to live. You cannot live without kidney, like some sort of something functioning like your kidney. And so dialysis does not cure your kidney disease. All it is acting like a third kidney, an external kidney outside of your body.
Yeah.
That's all that it does. So dialysis itself does not cure your kidneys, and unfortunately, there are no cures to kidney disease. A lot of it is prevention. There's no pill, that can give you more kidney function. Oh, and I forgot to mention this too. Like the kidneys that we're born with are the kidneys that we have for the rest of our lives. It does not regenerate. And so any damages that happen when you're in the womb, damages that happen when you're a baby, all of those damages, right? And then as you go throughout your life, will continue to take your kidneys from here to here to here to here to here. And there's nothing that we can do to bring it back up. And so that's why, prevention is so big when it comes to preventing kidney disease. But yeah, dialysis does not fix your kidney disease, does not help at all with slowing progression of your kidney stones, because some people get put on dialysis, but their kidneys still have some function to it, but it's just not functioning well enough on its own, and so they need that additional help, that additional kidney with the dialysis. But it doesn't help slow, the progression of that. It does none of that. It doesn't affect our kidneys. It just acts like an additional kidney for our body, because we need our kidneys, or we need something like our kidneys, like dialysis, to survive.
Wow. Thank you. This is such a big topic. I feel like we need to just like hone in on this for another talk story. So I'm going to go back to pregnancy. I'm going to go back to my crystal ball. Okay. That the kidneys really are the crystal ball of your health. So, and we find this out that, in pregnancy, this is the first time women are going to the doctor regular. Like every month you have to go to the doctor for your pregnancy. And then at the end, you are seeing your doctor every week, or your midwife every week. And this is the first time they're actually getting monitored in their adult life. This is the first time they take a full blood panel. So that blood panel tells us overall what's going on with your blood, what's going on in your system, how does it function, and then we watch it. We do a borderline blood draw at the beginning of pregnancy, and then we do it at 28 weeks. Also at 28 weeks, that's when we do the gestational diabetes screen. And we found that we need to screen everybody and just see what's going on. And some people that you would think, oh, they're skinny, oh, they're white, oh, they still get gestational diabetes. So that's why we screen everybody. And we found that it is that crystal ball. If you are screening as gestational diabetic, it doesn't mean you have diabetes. It's just diabetes during pregnancy. It does go away. But we found that there are many people that it is the crystal ball. Within 10 years, they are getting diagnosed with type 2 diabetes. And so something that we're really going to push, and I know time is running out. This went by so fast, but the sooner you can go in and get tested, do the blood draw, come to care early. If you're pregnant, come see us as soon as you pee on a stick. What we've noticed is a lot of people are coming to us when they're 6 or 7, 8 months pregnant. And by then, we aren't able to see what happened at the beginning of pregnancy and did your blood volume double appropriately? Did, when did you get gestational diabetes? Like by the time we see you and your A1C is already high, everything is really, it's really hard to keep that preventative care, to do things earlier on to make sure you're healthy your whole pregnancy. And so I'm going to beg you, please, as soon as you feel like your belly is growing, as soon as you feel like you missed your period, go see a midwife, go see a doctor. If you don't know what to do, every Friday I have ultrasound day at our clinic. So you can come in, get an ultrasound in the morning. I'll give you a tour of the birth center and give you options of where you can deliver. And then what we'll do is I could do a blood draw. Those are the things that I can do. I can get you an ultrasound and a blood draw on Fridays, every Friday morning. And then we can figure out, where are you? Where are you in your pregnancy? How far along are you? I've had people come in and we find out they're 36 weeks that they could go into dates. A lot of people are coming after 20 weeks. And so that means you've missed that time to really build up your baby's kidneys, to really beef up, like to build up your nutrition so that you can grow a healthy baby. And so I'm going to just beg you, please come early. If you know any of your sisters or your cousins who are pregnant and they're like, oh no, I don't want to go to the doctor, I'm shy, or I don't want to go because I don't like how they talk to me. I don't want to go because they can't even see me for 2 weeks, for a month. Everybody is booking out into January. I don't have time. Please come see us. We have Ala, who is one of our navigators, and we have Gabby, who's a navigator. Alinda is here. We have a lot of people that's part of the PI Health Board that wants to help you get access to care as soon as possible. And then Gabby, I don't know if you can pop back up and tell us, did anybody have questions on Facebook? So we're not able to see the chat and what's going on this end. Are there people out there that have some questions that you have for Dr. Reya on things that you're worried about or what we can help you with?
Hello. So I'm looking at the chat right now, and we don't have any questions, but more than not after they'll come up with questions. But we just want to say thank you so much, Dr. Reya, for hopping on and just taking the time just to tell us a little bit more about this issue and how we can better ourselves and better the moms that we get connected with.
Of course, Gabby. Anytime. I'm not on any social media or anything like that, so I can't share that. But if anybody can, if anyone has any questions, I can put my email here, and people can reach out.
And then Gabby, can you copy it and paste it into the Facebook Live?
Yeah, yes. Can you copy? And then also I put in this private chat, I put Tara's clinic website for people if they're not aware, to go visit that and visit Dr. Tara.
Yes. Go every Friday at the Rainier Valley Midwives, get your health checked. We'll go ahead and put that down.
So call ahead and we will, get you in as soon as possible. That's something that if we can see you early on, we can prevent. That's how you prevent it, right? You just get the help that you need. And there are people like Dr. Reya and there are me that will we see you, no questions asked. There's no judgment. We are here because we've seen this, we've seen this in our lives. We've seen this in our family, and we see that there's very few of us out here that look like us that are trying to do and improve this the healthcare of our own community. Um, Dr. Ray, I'm going to give you a minute if you could just come up with your last closing words of, what your vision is of this next year as you go into, you're finally there. You found your dream job. Like, I am just so proud of you. You're applying for funding. I just got to toot your horn a little bit. So Dr. Rhea did a community assessment this summer, a community needs assessment. She really wants your opinion. She wants to know, what do you want, and what is important to all of you, to our community. And now you're finally in your doing your life's work, the where you're actually in a place where you can make a difference. What is the vision of what you want to see this next year?
Thank you. Yeah, that's a really good question. And when it comes to, so my job primarily is research right now, but I do see patients clinically, like a few times a month. Um, but overall, like my career is research focused, and my research, like I mentioned before, I want to work with the community members and understand what you think are health conditions that we need to address, and what problems you think need solving, what barriers we have to having optimal healthy lives, and so I'm at that process of trying to understand that, so that I can take that information and work with community folks like Dr. Tara, and other people in the community, other community organizations, in order to design a health intervention that takes all of that into account, and is also takes into account our culture, right? Like the intervention itself takes into account pieces of our culture. And ultimately, the goal of those interventions is to improve our health by, introducing healthy behaviors, healthy, like education on healthy habits, as well as nutrition, to prevent diseases, including kidney disease. And so it's really about working with, NHPI, Native Hawaiian Pacific Islander children and their families, to build all of these healthy habits, to ultimately prevent chronic disease in our communities long term. And that is, research is such a long process, like this is my vision, my goal for my entire career is to like eventually hopefully make that sort of impact with working with the communities. But for the next year, it's about talking with everybody, right? Like talking with community folks, building those relationships, understanding what the community needs and wants, and speaking to people about kidney disease, doing everything I'm doing right now, but just on a bigger scale, while I, like you were saying, submit, these applications so that I can get money to do this work, and so, like I said, like research is just a long process. It's going to take years for us to even like get that health intervention and then, test it, and all of that. But that's the goal. And like this year, I'm just going to be working on speaking with the folks in the community, building my presence with everybody and building that trust. And then, trying to secure money to do all of this work for the next 5 years.
I'm so proud of you. Thank you so much. Thank you for landing here in Seattle in the Pacific Northwest. And, hopefully we can be a good ground, like starting ground of where you're going to elevate this work and take it throughout the nation and heal, and throughout the islands, right? We want you to be able to impact back home too. So
I just wanted to thank all of you also for like listening in, and then Thank you for you folks who completed that survey that Dr. Tara was mentioning. And shortly, for those of you that completed the survey and that want to see the results, I will be sending that out hopefully in the next couple of weeks. I have it drafted up, a nice summary, but I just want to make sure I get other folks to take a look at it first before I send it out to the different organizations and to the participants. And so that should be coming out shortly. And I appreciate your participation and your patience with all of that.
Awesome. Well, you're going to be a frequent guest here. So thank you for coming on. It was good to have you all. Gabby,
Yes.
thank you so much.
Yes, of course. Thank you, Dr. Reya, and thank you, Dr. Tara, for being on this talk story. I mean, like you said, it's really empowering and it's inspirational to have Pacific Islander health professionals like you caring for our community. So thank you so much. But before we close today's talk story, we want to remind everybody in the community that we are currently trying to enroll in our next childbirth education class. So if you or anybody that is in your family is interested, we're wanting to enroll you in our next class. So call our phone number at 253-235-5112 or email baby@pi.health board and we can connect you.
It was really fun. And so I think this next round, I think we should be more in person, more food, more coming together, a lot of movement. We did a lot of comfort measures, how to hold your partner in labor, how to rub their backs, what really works. And so it'll be nice to see everybody. So please join us. Okay. All right. Take care,
All
everybody.
right. Have a good one, everybody. Happy Thanksgiving. Goodbye.